My name is Nancy Botting. I'm the physiotherapist for the Canadian Wheelchair Rugby team. And I'm just going to tell you a little bit about the responsibilities that I have with the team. When I travel with the team, I'm the main medical person that is responsible for the care of the athletes the entire time that I'm with them, mostly for the injuries that they sustain. A typical day would be arriving at the gym with the guys if it's a practice or a game situation and helping them to prepare for the game. And that might be helping them transfer into the chairs if they need help, although most of our players on our team are pretty independent and do not require any assistance with transferring. And we actually encourage that as much as possible. Helping them get their equipment ready, helping them put their gloves on, helping them tape their hands or their wrists if needed, helping them with their straps on their chairs so that they're strapped in appropriately, and making sure that everything that they need is looked after. I'm also responsible for their hydration, so making sure that they have water with them, making sure that they have water or Gatorade as part of the practice. I also make sure that they're well warmed up for their practice or for their game, so I may help them with stretching their neck muscles, their chest muscles, their shoulder muscles, their upper back area that they tend to overuse a lot. I also help them with any warm-up that they have. Sometimes I participate in the warm-up a little bit with them and make sure that they're warming up appropriately for the game or the practice. At the time of a game, I'm the first-line first aid person, so I have a lot of experience not only as a physiotherapist but also as a first responder or first aid person. So if they get cut or there's an abrasion or there's any injury that happens, I'm the first person that goes onto the court and helps them to right their chair and make sure that they're okay. Some of the issues that we may see are a concussion or a hit of their head, and so I make sure that they're okay to return to play. If they have a cut, I cover it with a Band-Aid and help them get back into the play as quickly as possible. I'm also the person who tells the coach whether the athlete is able to continue on with the play, and so determining whether they're ready to go back to play or not is one of my primary roles. So basically anything that happens on the court that potentially could harm the athlete, I will be responsible for assessing the situation and returning them to play. Once we're back at the hotel when we're traveling with them, I help with any of their personal care that they may need, any of the toileting issues that they may have, although most of the guys on our team are completely independent in that respect. If they get ill when we're traveling, I'm the first line of defense to make sure that if I'm not sure of what's going on, that I can actually take them to a doctor or hospital or a clinic if needed. Back at the hotel, I will often do a lot of treatment. I do some physiotherapy treatments for them on their neck and shoulders and upper back. That might include some massage, some manual therapy. I always travel with some modalities. Could be a portable ultrasound machine if needed to help their body absorb any inflammation or irritation that they might have. Not necessary, but I'm also trained in acupuncture, and we use a lot of acupuncture for pain control with these guys if they do have any issues. So now I'll just go through what a typical first aid kit may contain. I have with me right here my sort of basic kit that I have. It's just a plastic case, and here are some of the things that I carry with me on a regular basis. Some of the items might be an antiseptic wash for wound care. We always have gauze pads in for cleaning up any abrasion that may happen. Going on with wound care, we have various types of Band-Aids. We always do really well with a large Band-Aid and some typical Band-Aids in here as well. We have little alcohol swabs for cleaning off the area before we dress it. We have, for covering just scrapes and abrasions, we have this product called Hypafix, which is a surgical dressing that it has a plasticized back, and we pull it off and it's adhesive, and we can cover any scrapes or cuts that they might have with that. I have various types of taping supplies in my kit. This is really helpful for taping wrists or fingers. This is just white zinc oxide standard athletic tape. We have this, and we also have some elasticized tape for going around muscle bellies. This is called Elastoplast. We also have a product from Japan that's called Kinesio tape. That's a stretchy adhesive that we use to tape shoulders, necks, forearms, that type of thing. For covering dressings, we have some waterproof tape. We always carry with them, and the athletes tend to like a lot of the deep heat. So this is a couple of different types of deep heat liniment that we rub in when we're doing some massage. We have some sort of anti-inflammatory cream. There's a couple of different types that I have here that will help in the post-exercise phase for helping them to recover. We have different types of scissors to help cut off any loose tape, or if I needed to get at their underneath their garment or whatever, I could use this to cut off things with. We usually have some deep cold ointment. We also apply a lot of ice, so we always have plastic bags in the kit where we can just get ice to use for any acute injury. In terms of wounds, I have polysporin to keep the wound nice and clean. Some of the guys have wear glasses, some have contact lenses, so I always have some moisturizing drops for the athletes that wear contacts. We have some, these are called Steri-strips, so if they have a cut on their face or on their arm, this will quickly close the cut, and you can get these from any pharmacy. We always have tensor bandages in the kit for helping to immobilize an area that might be injured. It also is really helpful to put some ice, strap an ice pack on a shoulder, and then the guys can still wheel away while they have the ice pack. They don't have to be stuck in one spot. I always carry surgical gloves with me just to protect myself as well as the athletes when I'm assessing something that might be bleeding. I always make sure that I have gloves on. We do carry some basic medication in the kit, some over-the-counter medications such as Advil for anti-inflammatory properties. We do carry Tylenol for pain relief if needed. We always carry Imodium or Gravol if they have an upset stomach when we're traveling. Just some basic medication like that. If we do require any further assistance with medication, we always seek the consult of a physician. Although I'm a physiotherapist, many teams also travel with a nurse or a healthcare aide or a sports trainer. As long as the person involved with your medical has experience with first aid and has a sound understanding of athletes with spinal cord injuries, and it feels comfortable working in that realm, then you don't have to be a physiotherapist specifically. There's, some teams also travel with a nurse as well as a physiotherapist or a massage therapist or a physio and a massage therapist together. So this is the medical file that we have on each of the athletes, and in here we have different sections. The first section is their medical history in case they ever need to go to the hospital. All the pertinent information is in there, including their insurance information, the date of injury, the mechanism of injury, and any medication that they may be on at this time, and anything else in their past medical history that may be relevant. And then in the second section I have the treatment that I do on them, and I keep a log of all the therapy that I do. I also have staff medical history records, so when we're traveling with the athletes, in case I ever needed to take one of the staff members to the hospital, we have a complete history on everybody, and if I do any treatment on them as well. And then at the back we have for the development squad, in the back I have medical histories on all of them and treatment logs on all of them.